Good day, everyone. I'm Dr. Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit, and I'm pleased to be back here to do the next session, Q&A session with the Ask the MOH, and thank you very much for those of you who did submit questions. So I'll now ask for my first question.
All right, well, the first question is, will the provincial reopening strategy be a one-size-fits-all approach?
Okay, so that's a great question. So as we understand it right now, the direction from the province is that it will be a one-size-fits-all. So the measures are going to be reopened at a provincial level. And there's advantages of doing it that way, and in many ways it makes sense, so that different regions aren't opening up at different times could actually present some risks to certain areas. I will note actually that overall here in the Thunder Bay District Health Unit and in Northern Ontario, we actually did very well compared to the rest of the province. So some of our numbers and the rates of infections that we saw in Northern Ontario were generally less. And I think there has been questions about whether that might mean that an area like Northern Ontario or Northwestern Ontario could reopen earlier. But as I've indicated, there are potential risks of doing that if the rest of the province isn't also reopening. So I'm supportive of it being provincial in terms of the reopening strategy. I will point out, though, that as we move forward, there may be certain recommendations that we will have that will be specific to our area, like the Thunder Bay District Health Unit, or maybe more broadly Northwestern Ontario or Northern Ontario. We've already made some of those recommendations, in fact, around travel. For example, individuals who are returning to Northwestern Ontario from other parts of the province or other parts of the country should self-isolate for 14 days upon their return to Northwestern Ontario. So that was a recommendation that we made here that is still in place. As we move forward, we may continue to make specific recommendations around our area, and then we might back off of those recommendations if our numbers sort of indicate that we can. So we will have some flexibility in those recommendations, but broadly we'll follow the province in terms of the broader reopening strategy.
Great. Okay, next question says, what are your thoughts on the risk to TBDHU region of a second wave?
Okay, so good question. So I think that, when you look at a pandemic, and when pandemics have occurred in the past, such as a influenza pandemic in the past, it often comes in waves. So you get one wave where there's a rise in cases, and then it sort of settles down. And then there could be a second wave. We've never had a coronavirus pandemic in the past, so there is a lot of uncertainty. However, I think that it is likely that there will be a second wave of COVID-19, and we need to prepare for that. However, with all the uncertainty, it's really hard to know when that second wave might happen, and similarly, what that second wave could look like. So we're at the end of the first wave of this pandemic. So it's hard, though, to know what the second wave might look like, especially for the Thunder Bay District Health Unit area. I will say, though, that we will go into any second wave much more prepared, and that will give us a huge advantage. So we will know more about the virus and how it spreads, and more about what the public health recommendations might be. We will also have all the lessons we've learned over the last 2 months that we will use to inform how we're going to handle the next wave. One of the big lessons that we should take a lot of comfort in is that we were able to flatten the curve in Thunder Bay District Health Unit. And we did that very well. I mentioned in the previous question that we have lower rates of the COVID-19 in our area compared to Southern Ontario. We could do that again because we know how to do that. And we were so successful in the first wave that we avoided a big surge in healthcare and on the hospital system. And we know what works. So I go into any second wave knowing that we'll have a lot more knowledge and we'll have a lot more experience with that. And I'm confident we could do the same thing again. I will come back to those some very basic messages of why we were successful in the first wave. It's all of those things that we do as individuals, as families, or more broadly as a community and as workplaces, for example, or organizations. All of those basic measures, the hand washing, covering, if you are sick, like if you have any symptoms, stay at home. Stay at home and isolate and so that you're not spreading whatever virus that might be to somebody else. And also, if you're going out into the community, if you're going to the grocery store, if you're going for a walk to get exercise, always maintaining that 2-meter distance, that physical distancing is vitally important as we move forward even to the next phase where we might have sort of fairly low numbers of cases for a while, but even in the next phase, the next wave, which could maybe that wave won't happen until the fall. But those same very basic messages will apply, and I think we should take comfort that we know what to do, and that we can make a difference with any further waves that come.
Okay. The next question asks, what are your thoughts of the idea of the family bubbles that other provinces have put in place, and perhaps expanding those bubbles?
So that's a great question, because there's so much talk about reopening that's focusing on businesses and parks and things like that we haven't really heard that much about what does that mean for us as families or as individuals. And I think what that question is referring to is the concept of sort of there's a bubble that we currently have. Our bubble is generally our households who we're living with at home, which is generally our family members. It doesn't have to be, but and that we're in close contact with a few people in that bubble. So our that family. And what other provinces have done is they've sort of expanded that. So for example, one family can be interacting with another family in close quarters. So the bubble has expanded to essentially 2 households. Now, at the present time, that's not recommended. There's no expansion of that family bubble at the present time. And in fact, I wouldn't recommend it right now. Our numbers, especially across the province, are coming down, but they're still too high to, at this time, to be able to say that we can expand those bubbles safely at the present time. But if we keep trending downwards, as we have been over the last couple of weeks, that may be something that happens in the near future. Maybe in a couple of weeks from now, for example, we will be allowed to maybe interact with more people in a still a fairly confined way. So too early right now, but that may be happening in the future. And I think that will be actually a good thing to happen at the right time.
Great. Well, I think we're all looking forward to that.
Yes, I think that will be nice.
Our last question this afternoon says, how can I protect myself as an employee when my workplace opens up?
Right. Okay, so that's a great question, and certainly it's something that we're even looking at here for the Thunder Bay District Health Unit workplace. So first of all, I think I'm very reassured by all the guidance that's coming out about workplaces and organizations. There's clearly a lot of work happening at different levels that is about supporting workplaces and putting together that guidance and the recommendations that of things that individual workplaces can do to be able to support the health and well-being of their employees, and to maintaining all the precautions that allow employees to perhaps go back to work, even interact more with one another, but to do it safely. And a lot of it comes down actually to all of those basic measures, right, around physical distancing and maintaining that 2 meters and those sort of opportunities. And some of the guidance include things like still having people work from home, or if they're coming into a shared workspace, doing that safely. So what does that look like, and how even one can position where people are working, how people are working, maybe still meetings through electronic means rather than getting together, for example. How to support effective hand washing and all of those other measures that can be done in a workplace setting. Even what we see is in some of the service organizations, more use of plexiglass, right? So if you can't sort of separate by 2 meters, a plexiglass barrier where 2 people can be interacting, like a client and somebody serving that person, but do it in a safe way. So we're going to see more of that. And more different policies and procedures about how workplaces are going to be managed. And so as workplaces begin to do that, certainly as an employee, you could ask your workplace, and especially those who have occupational health and safety departments, they'll be quite involved in this. So you could certainly ask your employer if they're, or they might be telling you already about what they're going to be putting in place to enhance the safety and the overall physical and mental well-being of employees. So yeah, there's a number of things that are happening that will really support that. I'll just remind you, though, I think there's some fundamental things that you could do. One of them is just assess how you're feeling. If you are feeling sick, even with really mild symptoms, maybe something that's new to you, a headache, runny nose, sore throat, anything like that, it is important not to go to work, not to interact with others, right? Because that could be COVID, and we know that COVID is very tricky. So we would really encourage people, if your workplace is opening up, don't go to work if you're sick. Stay at home. You might be able to work from home. And you could also, if there is a concern, you could give us a call, because we can arrange for you to get testing, for example. So that's one big recommendation I have to protect your workplace. And I certainly would encourage that for everybody, and for employers to support their employees not coming to work, right, if they're sick. So that's one key message. But all the other messages as well, right? Hand washing. If you do need to sneeze, maybe you have allergies, make sure you do it in your sleeve. And then just maintaining, of course, that physical distancing between people.
Great. Well, that was the last question this week.
Okay. So I want to thank you again for submitting your questions to Ask the MOH, and I know there's an email address for that. We are going to be continuing to do this next on a weekly basis, so just you can keep submitting the questions. I'll also note, actually, that we really want to hear from kids. And I think our next one, where we're looking at getting some questions from kids or young adults. So pay attention to our social media channels, because we will be providing more information about that. So that ends our session for today. So I hope you all have a good day and a good weekend that's coming up.